Hi, I'm Dr. Anthony. I'd like to share with you the importance of getting treatment by a chiropractor following a motor vehicle collision. And it's important to understand when there is a motor vehicle collision, you have a couple thousand-pound objects striking each other, and there's a significant amount of energy that's transferred from one vehicle to the other vehicle. A lot of times you'll hear if the car wasn't damaged that it's impossible for the occupant to be injured, and this is absolutely false. Research shows that actually vehicles that have minimal damage, the occupants suffer more injury because there's something in the vehicle called a crumple zone. The crumple zone is that's the point in which a vehicle is impacted where the car will deform, and what it does is it deflects the energy that's transferred from one vehicle to the other in the form of noise and heat. So when you have a small impact, like a 5 to 10 mile per hour impact, that energy goes directly into the person and usually goes right into their spine. When that seat gets ramped, it spikes the spine up, and it transmits compressive and shear loads into the cervical spine and the lumbar spine. So it's very common to see herniated or injuries caused by a low impact collision to the cervical and lumbar spine. So after we complete a physical examination and we do a small battery of different treatments in our facility, we want to look for different things in our examination, in our motor testing, and our sensory testing, and our neurologic testing, orthopedic testing also, to see if a MRI or a X-ray is medically indicated and warranted. After we order the MRI or the X-ray, the types of X-rays that we order are flexion extension X-rays, where you're in an upright position, bending your body one way and bending your body the other way. And what we're looking for here are intersegmental motion patterns. You might not have a herniation, but you might have a torn ligament in the spine, which creates excessive movement in the vertebrae. And that excessive movement over time leads to shearing and a premature breakdown of the disc. And you want to get that addressed as soon as possible, because any injury has 3 phases of healing. You have the inflammatory phase that takes place in the first 3 days. Then from the first 3 days up to 3 months, you have the repair phase. And the repair phase is when the body is laying down collagen type 3 fibers. And those collagen type 3 fibers are laying themselves down in a very unorganized, unsynchronized pattern. You have 10 ligaments that hold the spine together. The disc is also a ligament. The organization of these ligaments is in an intracellular connective tissue matrix, very similar to your clothing. So when you have a disruption of those molecular bonds in that intracellular connective tissue matrix, now the body is going to start to lay down a scar tissue. So that scar tissue needs the collagen type 3 fibers. So those collagen type 3 fibers, if you don't work on the elasticity and the pliability to build up the strength of those fibers, what happens after 3 months, those collagen type 3 fibers change over to collagen type 1 fibers, and those are the permanent fibers that you're stuck with. Now, research shows this is orthopedic in an orthopedic journal right here. This is indexed, peer-reviewed literature, shows that the intracellular connective tissue matrix, the healthy fibers, your body will never get back to those healthy fibers, the ones that were pre-injury status. The best you can get to is 70% as strong and 70% as elastic. So we want to do treatment in that first 3 month, month window, to build up the elasticity, the pliability, and the strength of those fibers. So when your body does change those collagen type 3 fibers to collagen type 1 fibers, you're left with a stronger piece of scar tissue there. And then the MRI is important to determine if there's a space-occupying lesion, such as like a herniation, putting pressure on any neurologic element, being the nerve root or the spinal cord itself. We like to review our MRIs with our patients so we can see in black and white exactly the extent of the lesion. We call it a lesion or a derangement of tissue when you have these types of injuries. So we'd go with the MRI, we go with the flexion extension X-ray, and if we have ongoing negative sequelae effect of this trauma after about a 1 month, 2 month period of treating with us, then we want to order a nerve test to see if there's any degree of nerve damage. That's an EMG NCV test that we refer you out to get. So if you've been in a motor vehicle accident, it's very important to be examined and diagnosed by a qualified physician who is an expert in this field. So if you have any questions or you want to reach out to us, feel free to contact us. You can reach us at 215-743-5330.